The Brainmender podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. It is strongly recommended that all users of this podcast should not disregard or delay in obtaining professional medical consultation for any medical condition they may have, and should seek the assistance of their healthcare professionals before making any decisions about their medical care or treatment. Thank you for listening to Brainmender.
We hear a lot of talk about the potential benefits of CBD and hemp extracts, but we hear very little about the risks. When we're being mindful about our health and using an integrative approach, it's really so important that we have as much information as possible about what we're consuming. So we may not want to hear the sort of bad news that there are potential risks when it comes to CBD and hemp, but frankly, we need that information. Join me and learn all about the potential risks and side effects of CBD and hemp. I'm Dr. Shawn Masia, and this is Brainmender. So we're going to discuss cannabis in a later episode, but there is a lot of confusion of what is the difference between hemp and cannabis. So basically, let's just lay it out. Hemp is actually a species of cannabis. It is a cannabis sativa species called Cannabis sativa linnaeus. And the major difference is that it is a little defective. It's a little mutated. And why are we talking about it? Well, hemp is the major source of CBD that you see on the market. So in fact, even when you're taking a so-called hemp extract, we can call it by any other name, it's still a cannabis extract, just one that is defective in making THC, which is the main sort of psychoactive component of cannabis. But it's basically the same plant. And in fact, most species of hemp do retain a very defective ability to produce very small amounts of THC. So many hemp extracts do contain very small amounts of THC. We're going to talk about why that's important later on today, but you can find CBD in almost any corner shop in the United States right now. And even in states that it's not legal to do that, you can order it online right to your doorstep. So what's the deal? Is it completely safe to do this? And it's really important to think about. And where are you getting your CBD from, and where are you getting your hemp extracts from? Are you just going down to the corner store and just buying whatever brand had the flashiest box on it? Because we're going to talk about some of the important things to look for and to avoid in this industry. A really important thing to understand is that this is a $2 billion a year industry. And they are not required to tell you about the risks of their individual products. They're also not allowed to tell you about any actual benefits because these are not FDA-approved medications, either by prescription or over the counter. These are regulated as supplements. And in the supplement market, we're not required to talk about risks and benefits as that industry. So there's a lot of information out there that points to, well, CBD might be helpful for this and hemp might be helpful for that. But no one can actually claim that their product has any of those benefits. Okay. The other thing is that the way that it's classified may be changing. So the FDA recently released a statement back in January, and they said, hey, first of all, cannabidiol is a prescription medication called Epidiolex. And so we're not sure we're that comfortable that it's contained in all these products. We don't know of another prescription that just happens to be in all these supplements that we're saying are legal. So the FDA is taking a close look at how it's going to regulate products that contain derivatives of hemp and particularly cannabidiol or CBD. And certain states, in fact, have filed lawsuits against different companies at the federal level, claiming that, look, this product contains small amounts of THC, and that is illegal in this state. And so people are importing this product into our state illegally. And don't worry, I don't think they're going to go after any consumers, but it is something to be aware of and to be mindful of. So let's talk about some of the major risks. First of all, let's talk about the fact that there are drug interactions when you're taking cannabidiol or hemp extracts. And we're going to use those terms basically interchangeably because it's very rare that you're taking an isolated CBD extract. And those products do exist out there. But most people that are using CBD are using a hemp extract. So we will be using those terms interchangeably on this pod today. So basically, the drugs that are most concerning are things like blood thinners, anti-seizure medications, and antidepressants. Those are the three main classes of drugs that seem to have the most problematic interactions with hemp extracts. And they can vary in their effects. So some of them, if you're taking a hemp extract, the drug levels may go up. And some of them, the drug levels may go down. And so it's important to discuss these decisions with your healthcare provider who is prescribing these medications for you. Like, hey, I'm on a blood thinner, or I take a medication for blood pressure or for seizures, or I'm on an antidepressant. Those are things that it's important, any supplement that you're taking, to discuss that with the healthcare provider who's prescribing that, so that they can look into whether there's any concerns that it could affect the primary therapy that you're on for that other problem that you're having. So, what could happen is, well, someone who's on a blood thinner starts taking a hemp extract, and all of a sudden the levels of that blood thinner go through the roof, and then they become more prone to bleeding complications, for example. Or somebody who has been doing really well on their anti-seizure regimen all of a sudden starts taking a hemp extract, and now all of a sudden it's not working as well as it used to. And that's because these levels are interacting with one another. And we have to be careful about that. A recent study showed that supplements that are available on the market that claim to contain cannabidiol may contain up to 42% more cannabidiol than's listed on the box, or even 26% less cannabidiol or CBD that is listed on the box. Think about that. So because it's in this supplement gray zone where we know that this is something that acts on your body. I mean, all of the hemp extracts out there that truly contain hemp extracts, we know they're going to do stuff to your body. We know they're going to do something for your brain. So don't we want to know exactly what's in them and be able to control the amount that we're taking on a daily basis and know exactly how much we took? So knowing that there are all these products out there that have done a really poor job of quantifying and making sure they control the amount of cannabidiol particularly that's in their product is important. And it will lead to some suggestions that I'll have for you a bit later today. There's another really important concern that we touched on before, is that a lot of these supplements contain small amounts of THC, tetrahydrocannabinol. Now, not enough to get people high, okay? It's really small amounts. However, if you're the type of person that's in a role where you're getting drug tested, that may actually be a very considerable concern for you. There's a case of a woman who was taking a CBD oil for her back pain. She had severe chronic back pain for over 13 years, and she found this CBD oil, and all of a sudden she felt a lot better. She felt like she could do her job a lot better. Well, what job was she doing? Well, she was a bus driver, okay? So she was sitting most of the day, and her back would be killing her. But when she started using the CBD oil, she felt much better, and she was able to tolerate her work. Well, unfortunately, her employer was required to drug test her. She didn't even think twice about it. She didn't, I'm not taking cannabis, I'm taking CBD oil. Well, her drug test showed that she was positive for THC, and her employer had a zero tolerance policy. And this led to a domino effect because she had failed the drug test. They're required to report that to the state. She lost her bus driver license as a result of that. And this is still getting litigated to this day. But it is a real caution story, right? It's a red flag that if you know you're in a role that they're going to be drug testing, you have to be very careful about taking even just CBD supplements. People who are in the military, people who are healthcare workers who have drug testing on a routine basis, people in the air travel industry, anything with federal oversight, basically. And, employers will disclose to you whether you're going to have drug testing. And it's important to know, hey, listen, I'm not saying you're doing anything wrong, but it's very important for you to understand that these supplements can contain small amounts of THC. Another problem with some of the supplements is that they may contain contaminants or other harmful additives that the manufacturer is just putting in there. And so it's important to look at these things and look for what we call a certificate of analysis. Does the product you're buying have a certificate of analysis? So what this is going to be is a third party has a laboratory, has tested this product for things like how much CBD does it have in it? How much THC does it have in it? Are there contaminants, heavy metals? Are there other substances that are not listed on the label? And what I'll say is the good companies have these available for you, and particularly the medical grade companies. So, for example, you can get a CBD product at a medical cannabis dispensary if you are certified for that, or even at the recreational dispensaries. Many of the products will contain a certificate of analysis. Some of them online also are very high quality products and will have a certificate of analysis available for you. You really want to look for one that has this because you want to know exactly what you're taking into your body. And again, I urge you to talk to your healthcare provider about that supplement. So let's talk about the weird gray area that cannabidiol is in with regard to its regulation, because it is an FDA approved prescription drug. And so there's tons of data on the packet insert that have to get done anytime you have a prescription medication in the United States. That means there has been rigorous testing by the FDA, and that there have been thousands of people who have taken this in what we call a drug trial. And they take all of the data from those trials and they put it into what's called the package insert for that drug. In the case of cannabidiol, there's a drug called Epidiolex, and it is approved for anti-seizure medication use. Now, what it's approved for are very severe forms of epilepsy, called Lennox-Gastaut syndrome, Dravet syndrome, tuberous sclerosis. These types of syndromes are what cannabidiol is approved for. And so these are people with pretty severe underlying medical conditions. Just as a caveat to how do we use this data, because does it really apply to the population at large? The other caveat to the data is most people that are taking hemp extracts or CBD supplements, they're probably taking between 50 and 100 milligrams per day total of CBD into their bodies, whereas these people in the studies that I'm referencing were taking up to 20 milligrams per kilogram per day of CBD, and that could be up to 1,000 milligrams per day. So the dosages in the study were also much higher than you would typically see someone taking a supplement would be using. But nonetheless, I'm a firm believer that anything we take into our bodies can cause side effects, and that it's extremely important for us to monitor those things. When we're thinking about our health in general, and we're thinking about what can we do to help ourselves, we also want to know, well, this thing that I've chosen that I think is going to help me, is it helping me? So we want to be mindful, especially during the first weeks of therapy. What am I feeling? So some of the common side effects that people were having were feeling extremely tired, having a decreased appetite. Now, that might be a little counterintuitive. People think, oh, cannabis and CBD, they help you with your appetite, right? Not necessarily. It can decrease your appetite. Some people were having pretty severe gastrointestinal side effects like vomiting and diarrhea. Fatigue was common, like I said, sleep disruptions, even fever. And basically, there is some other concerns that I'm going to reference now. And I just want to warn people that the content is a little bit sensitive because I'm going to talk about depression and suicidal thoughts. But any anti-epileptic drug that you take can potentially increase suicidality. And that's just what the data shows. So that in this study, cannabidiol, when it was used in these very high dosages, did have some association with increased depression and increased risk of suicidality. And look, this was in a very small subset of people. And again, they were using much higher dosages than the general population. But I think, when we're talking about such a common supplement that's so widely available and everyone's saying, hey, it's great. Well, let's talk about the real story and what the actual risks are for this supplement, because they're out there. So that these are extremely important symptoms to be looking for. And again, if those are the types of symptoms that you or your friend or your family member start to experience with anything, really, but especially when they've started a new supplement like hemp extract or CBD, it's important that they seek medical attention and potentially reach out to the 988 hotline for assistance. So let's move on. We did talk a bit about drug interactions. I just wanted to throw a shout out for my healthcare providers out there that specifically turn off your brain if you don't want to hear these words. But we're looking at the CYP3A4 system and the CYP2C19 liver enzymes. These cytochromes are induced by cannabidiol. So any drugs that are metabolized by that pathway are things that we really want to look out for. What else is really important about cannabidiol that people might not think about is, like I've said, it's an anti-epileptic drug. It's an anti-seizure medication. So if you're a person with seizures that is using cannabidiol to control them, it is extremely important not to abruptly stop it. And I would say in general, it's important for people to always speak to their healthcare provider like, hey, this supplement is no good for me. I'm having really bad side effects. I want to get off of it. Let's get off of it safely. Let's not abruptly stop it, especially if we've been using it for a while in decent sized dosage, because that can have what we call withdrawal seizures. And that can be very dangerous. We don't want people having any seizures. We don't want to do anything that could end up causing seizures. And abruptly stopping at least high dose chronic use of cannabidiol could potentially lead to an increased risk of seizures. One of the things we always talk about with supplements is like, well, how much are you supposed to take and what's going to be effective for me? And the problem is we don't really know. There are no standard dosage or treatment regimens for supplements. And again, the way that they're marketed, the companies can't really tell you like, hey, take this much. You might see suggested use. That doesn't mean it's the right dose for you. So the suggestion there is whenever you're starting a new supplement, but especially hemp extract, is to start low and go slow. And again, look for these side effects. Look for, well, how is it affecting me? So if you're taking a very low amount of it, first of all, we're going to screen you out for another very important side effect, which would be, hey, it's a plant extract. Maybe you're allergic to it. Okay. We don't want people taking high doses of something that they're allergic to. So starting low and only increasing in very small amounts. And that's what I mean by going slow. So over the course of weeks, you would slowly increase your supplement as long as you're tolerating it. And some of the initial side effects, like feeling tired, they might go away if you're on it for a couple of weeks. Those types of side effects might go away. But if you're having severe side effects, that's something you really want to be mindful of, because you don't want to continue something that's actually doing the opposite of what you wanted to start taking it for, right? Let's talk about there are these high CBD strains, okay, and it's basically hemp strains that are available, and people smoke them. So I'm just here to tell you that smoking in any form is potentially harmful to your body. Our lungs are not made to take heated smoke into them. And I don't want to get up on the soapbox here because that's not what we're about. We understand people are adults. They're going to make their choices. And hey, every once in a while, someone's going to do something that socially makes them feel right, or just by themselves. Hey, smoking something helps calm me, and that's their belief. I get all that. But when we're talking about medicinal supplements and medicinal extracts, I would say there's so many other healthful ways to take these extracts that smoking just isn't one of them. So I would just say be very cautious about thinking that, well, hey, it's not tobacco and it's not cannabis, it's just hemp, right? Well, hemp contains combustible materials when you're inhaling that, and there are potential risks to that. There's tar in that, and there's other contaminants that your lungs are just not very good at clearing from your body. So I would just be very careful of that. And also when it comes to the vape pens and the heated oils that people are sort of vaping into their lungs. I mean, again, your lung is not designed to take a heated oil into it. That's very bad for it. And there was actually, over the last few years, a number of people that were suffering the pretty severe lung catastrophes from contaminated CBD cartridges. And again, these were people that said, hey, well, I'm not smoking, I'm vaping, it's not bad for me. In fact, even the e-cigarettes that you see for nicotine, tobacco, certainly it's more healthful than smoking tobacco. We know that from tons of British data, but in and of itself, it's just a behavior we want to avoid. It's just not vaping anything. It's just not a healthful behavior. There are more sort of holistic ways of taking things into your body, and the easiest way is to eat it in its whole form. Nobody wants to just chew on a piece of hemp. I get that. So the next best thing are these hemp extracts that we're talking about, the tinctures and extracts that are placed into vegetable oil capsules that you can just eat. And then you're getting all those benefits that you would otherwise want to get. So just, off the soapbox now. Another really important point that there's very little data about these extracts in women who are pregnant or who think they might be pregnant. We don't know a lot about how these extracts interact with a developing fetus. So that's something that people really want to be mindful of as well. And then again, sort of taking that further, when we're breastfeeding, these we know are substances that are passed in the breast milk because cannabinoids are the substances that are contained in hemp extracts really like to go to fat, right? So they like to live in fat. And so they're attracted to milk because it contains lots of fat. And then it gets into the breast milk, and then that can be passed to the baby during breastfeeding. And again, that's sort of a place that we don't know a lot about. Well, what effect does that have on a developing baby? We don't know. So there's a lot of caution that should be taken when we're talking about pregnancy and breastfeeding when it comes to these extracts. So we've really covered a lot of ground today. I understand that. But certainly you have the option of going back and listening to your favorite parts again. We've gone through how important it is to your integrative wellness plan to understand exactly what you're consuming, to understand the healthiest way to consume it, and to really be mindful of when you're starting these supplements. Hey, let's keep an eye on ourselves. Let's start low and go slow. And we're going to stick to trusted brands that provide us with a certificate of analysis so that we know exactly what is in the things that we're putting in our body. And again, we need to know that if we're in an industry that does drug testing, that there are potential risks to taking a full spectrum hemp extract because they could possibly come up for a positive on THC, which would obviously be a negative for you and your employment. Any supplement can cause any side effects. So if you want to keep a diary or just really be mindful of, how is this doing for me? And also tracking, what is the thing we're trying to improve with this supplement? Tracking that. Okay, say it's pain. Well, I feel better today, but I feel really tired. So these are all important things that are going to play into your decision making. Well, thanks again for joining me for today's episode. Please remember to like and subscribe and share Brainmender with all your friends and family. And if you have questions you'd like for me to answer on a future episode, feel free to send them to podcast@sohomd.com. And you can find the email inside our episode description. And lastly, if you or someone you know is struggling or in crisis, please have the National Crisis Hotline at 988. Please call that today to get the help, and that is a 24/7 hotline. So stay curious, stay mindful, and nurture your ECS. I'm Dr. Shawn Masia, and this has been Brainmender.